You think you know when labor starts, but what if your body has been whispering clues and you miss them? For many moms, labor doesn't begin with dramatic contractions or a Hollywood-style water breaking. It starts quietly. In this video, you'll learn 5 surprising, often overlooked signs that labor might be much closer than you think. And by the end, you'll feel calmer, more confident, and better prepared for what's coming. Let's dive in. Number 1. You feel strangely energetic. Yes, you're 9 months pregnant, and suddenly, you're vacuuming the stairs, organizing baby clothes, and color-coding the pantry. That urge to nest is real, and it's often one of the earliest signs that your body is preparing for labor. It's driven by a natural spike in adrenaline and cortisol, your body's way of getting things ready for baby's arrival. So if you find yourself deep cleaning the fridge at midnight, don't be surprised. Baby may be closer than you think. Number 2. You lose your mucus plug, but don't notice. The mucus plug is a jelly-like barrier that seals your cervix during pregnancy, protecting your baby from infection. As labor approaches, your cervix begins to soften and open, and the mucus plug comes out. Sometimes it's obvious, a thick, stringy glob with a bit of blood. But for many women, it passes so gradually, they don't even realize. You might mistake it for normal discharge or ignore it completely. But it could mean your cervix is getting ready, and once that starts, labor might not be far behind. Number 3. Diarrhea, nature's unexpected prep. It's not glamorous, but many moms report a sudden change in bowel movements just before labor begins. Why? Hormones. As your body releases prostaglandins to soften the cervix, those same hormones can stimulate your digestive system, leading to loose stools or diarrhea. It's your body's natural way of clearing the path for baby. Uncomfortable? Yes, but totally normal, and possibly a sign labor is on its way. Number 4. Your contractions don't hurt. Yet you've probably heard of Braxton Hicks, those practice contractions that come and go randomly. But here's the twist. As labor nears, Braxton Hicks can start to feel more intense and frequent. Still not painful, but definitely noticeable. They may feel like a tightening or squeezing in your lower belly or even mild cramps. The key? They're irregular, but they often lead up to true labor. So when they start feeling different, take note. Your body is warming up. Number 5. You just feel off. This one is harder to explain, but many women describe a strange intuition. You wake up and just feel different. Maybe it's emotional, maybe it's physical, a sense of restlessness, pressure, even nausea or a headache. Your instincts are powerful, and sometimes they're the first signal that your body is about to start the biggest job it's ever done. Trust yourself. So, how do you know it's really labor? Here's what separates real labor from the dress rehearsal. First, contractions become regular. They get closer together, more intense, and longer. You may notice back pain or cramps that don't go away with rest. You'll likely feel increasing pressure in your pelvis, like baby is really dropping. And when you can't walk, talk, or focus through a contraction, it's time to call your provider. What if your water breaks? This doesn't always happen like in the movies. It can be a dramatic gush or just a slow trickle. Sometimes it's hard to tell if it's urine, discharge, or amniotic fluid. When in doubt, wear a pad, monitor the fluid, and call your OB or midwife. They'll guide you through what to do next. What should you do if you notice one of these signs? Start timing your contractions. Use a phone app or stopwatch. Pack or double-check your hospital bag. Let your partner know it might be close. And most importantly, breathe. You are not alone. Your body was made for this, and millions of women walk this path every year with strength, grace, and courage. You're one of them now. Final reminder. Labor doesn't always follow the rule book. Some signs show up days or even weeks before birth. Others come and go. But knowledge is power. And by paying attention to these small signals, you're giving yourself the best chance to stay calm, make smart choices, and meet your baby with confidence. Thank you for watching. If this video helped, please hit like and subscribe, and share it with another mama who might be in the same stage. You've got this, mama. See you in the next video, where we break down the truth about false labor and how to avoid going to the hospital too early.